Welcome back to Good Day State Line. Dr. Matt Stier and Dawn Vernon from Rockford Gastroenterology, I knew I was going to mess that up, Associates are joining us this morning. Good morning.
Good morning.
One of you feel free to restate exactly that big word I messed up.
So we work for Rockford Gastroenterology Associates. We're a GI practice here in Rockford, and we go to Swedish American Hospital and OSF locally.
There's a reason why GI is the abbreviation.
That's right.
Real
exactly.
big word.
Correct.
Real big word. So we're talking today, it is Colon Cancer Awareness Month in March, and it is so important that we're all checked out for all of these things, because some people think, oh, I have a stomach ache, and they just don't care about it, or they think it's not a big deal, and it really can be, right?
Yeah, absolutely.
Okay, so Dr. Stier, tell us a little bit about you and your practice.
Sure. So I'm one of 14 physicians. We also have multiple full-time nurse practitioners there, and we operate on Roxbury Road next to OSF in Rockford. We see patients on an outpatient basis, and again, we also go to the hospitals in town. And we do a lot of colon cancer screening work, and so we definitely appreciate the opportunity to be here and spread the word about colon cancer awareness and colon cancer screening here. March is Colon Cancer Awareness Month, as you're probably aware, and so it's a big goal to increase population-level screening for this preventable cancer, and one of the ways we do that is getting out there and talking to people like you and to patients about it.
So what made you get into this line of work?
Well, you know, that's one of the more common questions we get asked, as you might imagine, you know, before colonoscopies and whatnot. But
sure.
I think anybody who's met someone with a GI illness has seen how much it can impact their lives. And, you know, our relationship with the restroom starts very early on, and food is such a big part of our culture that if you're not eating well or your bowel habits are off, then certainly your lifestyle is very disrupted. And so, you know, we have the opportunity to really improve people's quality of life, and a lot of our patients improve and do better, and it's nice to see them thrive. And
you use the term preventable. That's huge.
It is, yeah. Colon cancer screening I view as a major opportunity, and being stewards of colon cancer screening is something we take very seriously.
So Dawn, you're not just hanging out. What do you do at the practice?
So I'm one of 7 nurse practitioners that we have. There are 4 of us based in the office that just do outpatient 5 days a week, and then the other 3 do stuff in the hospitals with the physicians. I get to be a part of a wonderful group that deals with a multitude of GI symptoms, and a lot of patients may come in for, let's say, heartburn, and we find out that they also need colon cancer screening.
Sure.
So I get that opportunity then to talk to them about having maybe 2 different procedures, or one with the oral medicine and then scheduling an outpatient colonoscopy.
So we're talking about colon cancer. What symptoms should we be looking out for, Dr. Stier?
Well, colon cancer can prevent with a variety of symptoms. Obviously, the one that everybody thinks of is blood in the stool or rectal bleeding. And so certainly anytime you see blood with bowel movements, that's abnormal. And so that would be something that you'd want to talk to your doctor about right away. But other less obvious causes would be a sudden change in bowel habits, sometimes abdominal discomfort or unintentional weight loss, even though you're eating a normal diet. Even vague symptoms like fatigue could be a sign of underlying iron deficiency anemia, which is one of the more silent symptoms or signs of colon cancer. And so anything that you're not sure about, it's best to check with your doctor, and they can often put you in touch with a GI specialist if they feel it's needed.
What are the options when it comes to screening for colon cancer?
Well, there are more options than there used to be. I think, you know, the holy grail of any screening would be to have a blood test that reliably detected cancer and precancerous lesions,
sure.
and then could plug people in for colonoscopies that way. Unfortunately, we don't have that yet. And so the gold standard is still doing a colonoscopy, which is a procedure that sounds very scary off the cuff when you hear about it, but almost always universally in the recovery room I hear, oh, that wasn't so bad. And so the best option, if someone is healthy and able to undergo an outpatient procedure, is to have a colonoscopy done where we can both look through the colon to detect any cancers or polyps that are there and remove them in the same procedure. And that's really the main benefit of doing colonoscopy as you're screening. It's highly accurate, it's highly sensitive, and you can take care of the problem on the spot in the same session.
All right, my last question, because I know this one is really important. At what age should you just be getting a colonoscopy no matter what?
So currently right now, the majority of insurance companies are starting at 50.
Okay.
Unless you're African American, and then it's 45. A couple of the organizations have started for screening now at 45, but insurance companies are slow to get on the same
Sure.
page. And so if we have patients that come in that want to be screened at 45, we ask them to check with their insurance company first.
Okay. And how can we get in contact with you guys?
Our phone number is 815-397-7340.
We're also available online if you search Rockford Gastroenterology Associates, and we have a lot of outstanding staff members that are there that can help facilitate any referrals and get you plugged in to see one of us
Wonderful.
as
Well,
needed.
thank you both so much for joining us this morning. Coming up next, our second Irish Tim is joining us here in the studio. We're actually playing a game with Lucky Charms with Tim Mahoney, and later we're talking Grammys with Lash Fairy all the way in Hollywood. We'll be right back.